Okay. Oh, I can do it myself. Hi, everyone. Welcome to Dialogue with Khuraira. If you're new to Dialogue with Khuraira is a platform that is for who we call the unsung heroes. Who are the unsung heroes? These are individuals doing incredible things in their various communities for the betterment of humanity. They may be doing amazing things, but if the spotlight isn't on them, you may not know about them. So we scout around and find them through friends, through social media, and we bring them to you so that you can hear what they are all about, what they do to change, make other people happy, and what got them to doing what they're doing. Because in everybody that does something for the betterment of humanity must have been touched somehow, one way or the other, and that is how they get to said, okay, listen, if I'm able to survive this, I should be able to do this to help others. So that is why we bring them. We learn every day from them. And today we have a gentleman from Accra, Ghana, and his name is Blaise Ackom. I will stick with the Blaise, but I'm sure he
Yeah.
will tell us exactly how it's pronounced. We were supposed to have Hajia Halima Idris. Unfortunately, she's not feeling well. So he was kind enough to say he's supposed to be our next week guest, but he said, okay, no worry, I'll make sure that we're here for you. So thank you so much, sir, for showing up for us, and our audience are more than happy to hear from you. Welcome to Dialogue with Khuraira.
Thank you. Thank you. Thank you. Thank you.
So please
Yeah.
tell our audience who you are, what you are about, and what made you to be who you are. We're all ears and very excited to hear about your story.
Yeah. So first of all, let me say hi to all those watching us across the world. And okay, so Blaise Ackom is a Ghanaian who hail from the northern part of Ghana, specifically Navrongo. But because of work, I'm working in Accra at the Madina Polyclinic. In fact, I started a campaign on cervical cancer awareness, and that was way back in 2016,
Yeah.
where one night I had a dream and I saw two sheets of papers folded in the dream, and something prompted me to open one. I opened the first one, it was cervical cancer. So I was saying, a man sees cervical cancer. What does a man has to do with cervical cancer? So I decided to open the second paper to just find out what is in the second paper in the dream. I opened the second sheet of paper. It was breast cancer too as well. So I just heard a voice that told me, pick this thing and speak about them.
Wow.
So from 2016, I decided to assemble a whole list of health professionals that we came together to help create awareness, most especially cervical cancer, because in Ghana right now, about 1,697 women are losing their lives out of cervical cancer. You know,
Yearly.
yearly, every year in Ghana,
What? Oh
every
my God.
year. And I even realized that in Nigeria, it's about 8,000 deaths.
Yes.
And it's also,
Yes.
yes,
Yes.
yes,
Yes.
yes. And
We had a
it's,
guest also who is actually the president of Cancer Society of Nigeria, and he
yeah.
was talking about that. And well,
Yes,
so go ahead. Oh my God.
yes. So,
Mm.
all these things motivated me to put this group of health professionals together to help go to the various parts of the country to raise awareness. And it was amazing that we started the whole thing. I funded the whole thing myself
Wow.
with no support elsewhere. I was depending on my salary, picking up, moving a car, moving up and down, paying fares for most of the health professionals. And I needed a team who understands my vision, whatever I
Yes.
want to do.
Yeah.
So it got to a time I had some few challenges where most of the health personnel realized that they need to be paid for their job. At times in some parts of Africa, most people don't understand the concept of volunteerism.
No,
So yes, so people feel
no.
that they have to get paid whenever they offer their
Yes,
services. Yes, so
yes,
it got to a time most of them, because they were not getting paid, they fell off, and it was left with and I think one lady who was also in support of the vision. So we
yeah,
continued for a while, continued to create awareness, and it got to a time I realized that no, we've been creating this awareness, and at time we get some of these women in these rural areas, and they have the willingness to screen for the cervical cancer, but they don't have money. So what do we do now?
yeah.
So
Wow.
at times, I will just pick about 5 women within a month and screen them for free. That's
Yeah,
what I can afford. Yes. So I
yeah,
pick 5 women every month, screen them for free. And as time went on, I got people who understood my vision. Some of
yes,
them will tell you, "Oh, Blaise, whenever you want to do things of this sort, you can contact us. We are also
yeah,
ready to help in one way or the other." So
yeah,
I got motivated by some of these people who were able to support me and were able to extend and help, and were all able to offer live screenings for more than 100 women in communities
yeah. Wow.
where all these women are screened, and they know the status of their cervix, and it's
Yes,
something that's yes, it's something that has motivated me till now. And one thing that we going around the country and we've realized is the education is low. Education about cervical cancer is low, and
yeah,
because it's about the private parts in our
yeah.
setting,
That's
talking
what I
about
was
the
gonna
private.
say. You know,
Yes.
people, that is a taboo. You cannot go to that subject. Yes, yes,
Yes, yes.
yeah,
So it's like society is frowning against maybe talking about those things, but it was a big challenge or a barrier, but we're able to find our way out to make sure that each and every language that the community members understand, we're able to
there's
channel
someone
that
that,
kind of, yes, we'll
yeah,
translate that kind of information to them, and people were getting to understand the dynamics of cervical cancer, how it occurs, and what they need to do. At times, some might, because of the nature of the condition, some might think that it's a spiritual thing. So instead of them,
yeah,
yes, yeah,
or
yes.
somebody had jinxed them or something like that.
Yes. So
Yeah,
instead of visiting the hospital, they prefer going to a herbalist. They prefer using some concoctions and other stuff. And by the time they get to the hospital, they get to the hospital at the later stage, and it's
yeah.
something that has been worrying. So, in fact, for these years, I've really done a lot, and especially in my hospital, Madina Polyclinic, in Accra,
Hmm.
since the inception of the hospital 50 years ago. I was the
Yeah.
first person who came to introduce cervical cancer and breast cancer awareness and screening in the facility.
Wow.
Yes.
So
Trying to,
amazing. Before we
yeah,
get to your practical, if you could walk our audience, your background, your medical background, and how you know, before your amazing dream that is
yeah,
making,
yes,
having you to do this, I think
yes,
that will help them to understand the level of
yes,
your education and why you know, you're committed to doing this, and how you
yes,
were able to also mobilize other
yeah,
practitioners to
yes,
join your cause. You
yes,
know, that would be
yes,
wonderful.
yes. So I'm a nurse by profession.
Yeah.
Yes, I'm a male nurse by profession.
Oh,
Since
see, this
20.
is another good thing that it's great to. I intentionally wanted that out because you know when people hear a nurse and they're like, and it's a male,
Yeah,
that ain't
yeah,
happening. But you know,
yes,
it is a job that also, you know, some male will prefer a male
yeah,
nurse than
yes.
a female
Mm.
attending to them, you know.
Yes, yes,
And these are jobs that, you know, a profession rather, that first of all, it is gratifying because you're
yeah.
helping people, and you will
People, yeah,
always have a job, you know.
yeah,
So
yeah,
go ahead,
yeah,
sir.
yeah.
Yeah.
So since 2016, I've been practicing as a nurse, and also I took it upon myself to be on the various screens in Ghana, like TV stations, radio stations,
Yeah.
to aside the cervical cancer awareness to
Mhm.
help educate people on various conditions when it comes to the medical profession. So
Yeah.
so currently I'm a nurse at the Madina Polyclinic in Accra. Yeah, doing
Wow.
this kind of
Wonderful.
amazing stuff. Yes, yeah, yeah,
Wonderful.
yeah,
Amazing. And, also in the last, like I told you, we had someone
yeah, yeah,
that talked about cervical cancer.
yeah,
And he was saying it's something that actually is preventable.
yeah.
And a
Hundred
lot of
percent
times,
preventable.
yeah, and a lot of times we don't even know that it's you can get vaccinated
Yeah,
uh, before the girls start any sexual intercourse.
sexual. Yeah, yeah,
So how do you find, did you like when you are going out there to do awareness, do you tend to have like a pushback from parents thinking that if they do that vaccine, you know how our people are, that
yeah,
means they are
yeah,
going to make their daughter barren, she will not have
yeah.
children, you know, that kind of taboo. How do
Yes,
you
yes.
deal with that?
Yes. So usually I always say that education is something which is key. At times most people, society, usually we say that we have doctors in our community, those who have never been to the medical school or any nursing training, we have a whole lot of stuff that they will tell you. In fact, when COVID came, when the vaccines came, they were telling people when you take these vaccines, the whites intended to put these vaccines in us so that it will kill all of us. So when some of these vaccines come, we will get a whole misconceptions about it.
Oh,
But the
God.
thing is,
Yes.
it's just a
Yes.
matter of we educating the people. So usually, I like the part that I will educate you and let you know that with cancer treatment, one is very expensive,
Oh,
and two, very very if you don't see it early, most of the cases that we have in Ghana, when you take about 10 cases of cervical cancer or cervical cancer reporting to the hospital, about 9 of them come in the advanced stage. And only palliative care will be done for. So you will spend a lot. So
yeah.
waiting for you to spend a lot than
Instead
maybe
you can
taking,
prevent.
yes, yes, than just taking the vaccine at the initial stages. That
Yeah.
will prevent or protect you from the human papilloma virus. And when
Yeah.
you give them some of these differences, people get to understand you more. And people at times people just want to know that, oh, these are the number of people who are dying from the condition.
If
Before,
exactly. That is an
yes,
eye opener, you know?
yes, yes.
Yes. Yes.
So
Because
when they
a lot
get
of
that
the
kind
time,
of,
like a lot of the times the statistics are not out. So if they're not out, people hide about why they are dying. Is the
yeah,
same thing in the case of like sickle cells, for
yeah,
example. It
yeah,
can be prevented. Actually, it can
yeah,
be reduced if people get to understand that it's not a communicable disease. It's just
yeah,
by awareness that if you marry this person and this person, this is the result.
yeah,
So, but family, when they have a child that has it, they hide it. They don't want anybody, and they will be telling when the person is having crisis, they will be lying the person have malaria. You
yeah,
know, well, so
yeah,
is this that is exactly what you're talking about. I think if
yeah,
our people start freely talking about uh, diseases that are prevalent in the community, and
yeah.
understanding this person died because of this and this could have been prevented,
Prevented,
they
yeah.
will take it seriously.
Yes, they will
So
take it seriously.
now that you got to that um, stage whereby now they're beginning to understand that, you know what, if we listen to Blaise, we work with this can really help us.
Yeah.
How is it, are you doing it through the schools? Are you doing it through the community leaders or the religious leaders or
Okay.
women
So
both?
yes, yes. So it's a combination of all that you've said. So we do it through schools, religious leaders, and community groups. And in
Yeah.
fact, some of the religious leaders are making the work very difficult for us. Some
Oh,
of the religious leaders are making the work very difficult for us. Currently, we have people with cervical cancer or with cancer lie
Yeah.
in prayer camps waiting for God to heal them in the prayer camps. So they spend most of their hours in prayer camps. Some pastor will tell you, do not put your trust in a doctor. Do not put your trust in a nurse. Do
In
not
this
put your...
day and
Yes.
age.
Yes. Now some of them are trying to psych the minds of their members that if you are not feeling well, it's the check that you need to come. It's not the hospital. So the first point of care that most people attend to is the church when they are not feeling well.
Yes.
So they'll tell their members, oh, when don't put your trust in a doctor, don't put your trust in a nurse, don't put your trust in a midwife. So what are you trying to tell your member? You are trying to tell your member that the only way you can be healed is through the church.
Yes.
So most of them spend their time at the church premises waiting for God to heal them, buying oils. Now some people too are selling. They are selling some fluid that they are saying is the blood of Jesus, and you know, yes, those cancer patients, they are still taking it. And you know, one sad thing is I have a patient currently who was being diagnosed of breast cancer and was supposed to start chemotherapy. This woman went back to the house, consulted some few people, and they sent this lady to a herbalist who gave this lady some capsules. This lady takes about 50 capsules a day. 50 capsules a day. 25 in the morning.
To the police? Can't you report it to the ministry?
Yes, so
like
at
the
times,
health agency?
Yeah, monitoring and all those kind of things is very poor.
Yeah.
In Africa, especially, we have people who are selling in market centers. They will tell you they can cure breast cancer. They will tell you they can cure cervical cancer, and they are in the markets. And at times, most of our leaders pass through those places and they never say anything.
That's terrible.
Yes, you get it.
That is terrible.
Just imagine.
he had actually taken the time that she could. She wouldn't. God forgive me, except if God does. I mean, we should not say that there's God does not heal, does not. But God didn't say, lay down, whoa, I will come from heaven and I will heal you. The reason why God made you a nurse, because he knows that some people will fall ill and you are given the brain to take care of them. He made up different kinds of doctors, different kind of people, practitioners. So people like, we need and even like leaders that try to tell people it's not right. It is not right. You know, because they are killing people indirectly, you know?
Indirectly.
And you know, these people, you don't touch their Passover. You cannot, don't even try it. So what I would have said, like what I would think maybe, would it be easier for you? Like if you partner with maybe a few prominent pastors that like people know of. If that pastor says something that nobody should argue, maybe if they buy into your awareness and start doing it, then it will reduce the other ones that even in the villages that maybe, because most of probably what is happening, it could be in the village or sometimes even inside the city. You know, you will be amazed what people can tell their disciples.
Yes, that's really true. But you know, now most of our pastors too are having bodyguards, and before you get access to some pastors, it's very difficult. You even book an appointment.
Why is the pastor getting a bodyguard?
That's the order of the day. Before you even get access to some of the pastors, you need to break protocols upon protocols before you get access to some of the pastors that are well known, that have a lot of followers. Yes, so it makes things very difficult. There was one time I went to a certain church in Ghana here just to create when I sent a letter to the church indicating that I wanted to do cervical cancer awareness for the members of the church. And it was like the pastor did not like the idea of me coming there to do awareness for them. Meanwhile, it was for free. The church was not paying me anything.
Yeah, you're
But
just doing it out of free
yes, yes,
and to save
uh,
his people so they can
ye-
keep coming and giving him the arms, you
yes.
know? Yeah.
Week in, week out, I've been calling, doing follow-ups on my letter, and it was frustrating. So it got to
So
a
if
day that I
do
just
you think if you go through like maybe the wife, uh, there's some pastors that have wives anyway, right?
wives, yes. At times
Yeah.
you can't even get access to the wife itself.
Oh,
That's our problem.
I
Because
see.
at
I
times they
see.
move hand in hand. Maybe you tell them that you want to see maybe the wife or whoever. They'll tell you you have to book an appointment, and with even the appointment, some of them it will take time before you even meet them. And at times, some of them you might not meet them. You meet their junior pastors. You
Yeah.
channel your information to
Who
the
do
junior.
not have any power. So
You
have
get,
you tried the clerics, like the Muslim side? Since you said you are from northern
yes,
Ghana, have you like
yes.
spoken to the clerics, or you still have the same pushback too?
No, so I have, in fact, I have some Muslim groups that I usually do awareness for them, and they are a lot. They are a lot, especially most especially on Fridays. I
Yeah.
get
Yeah.
access to these Muslim women's. I
Yeah.
give awareness talks to them, and
Yeah.
the feedback is very, very good. I'm a
Good.
Catholic too. Yes, I'm a
Yes.
Catholic
Yes.
too.
Yes. Yes.
Yes, I use the Catholic churches to create awareness, and they give us
Yes.
time. But with the problem that we have is the one man churches. Most of them are the ones giving us the tough times.
Yeah. The
Yes,
big
so
churches.
the big churches operated by
Okay.
one person, they are the
Yeah.
ones giving us the tough times. And at times they can even give you 2 minutes for a talk. How can you how can you invite someone and give the person 2 minutes for a talk? What am I going to talk about?
You
I usually
haven't
I
even
tell
said
them that
hello. This is what I do. You start.
yes, yes. So usually I tell them that
Wow.
these things, no one can fight cancer alone. It's a
No.
collective effort.
No. No.
It's a
even
collective effort.
even even in this country where there's so much awareness, still there are a lot of pushing of awareness. You go to your
Yes.
doctor, there's something about it. You go to school, there's something about it. Women groups, churches, mosque, people, synagogues, people are talking about. There are things
Yeah.
that you know especially cervical cancer and breast
Yeah.
cancer
Yeah.
is very, very
Mm.
um, serious. And if you can prevent it, for me that is the
Yes.
frustration, that
Yeah.
you this can be prevented if we could really just get people to listen to us. So I would think that maybe if you even get like the Girl Scout, that could be another way to because you see, one thing I realize with parents, you want to get to the mind of a parent, you go through their child.
Yeah.
So if you are able to go through the school, and the school is able to buy into, which I don't think a school will deny that.
Yeah.
And also maybe if you talk to like the principal or something, and say, maybe if they can organize a women a day, if the religious ones are difficult, because I think that wherever the women you can get access to women is what
Women.
matters.
Yeah.
You have like the choir, the women groups, that's another one. But if you say in terms of security, that is could be also. But if you can get a woman leader, and women leaders are very they're
Yeah.
smart anyway, and they understand. So there's that
Yeah.
already also from international NGOs that are talking to them about it. And the other thing, like what the other doctor that I told you is the president of Breast Cancer Foundation. I think you should also maybe partner with those kind of organization. You see,
Yeah.
because they already have even the funding somehow.
Yeah.
You
Yeah.
understand? So
Yeah.
you are going to just be a great extension for them, and
For
that
them.
they
Yeah.
could, because they can even help you. You are helping them, and they're helping you,
Yeah.
because maybe they are short of staff that they can't get to where you are going, but with their connection, their flyers already, all the things that they're doing, and already they are connected with the government. You see, it could be something because I don't see any reason why anybody should discourage something that is preventable,
Yeah. Yeah.
you
Yeah.
know. So
That's
definitely.
the,
My other thing that I wanted to, I don't know if we were able, but it's never enough to hear. At what age are they supposed to get the vaccination? And if that age passes, is there anything else they can do, or they just have to, you know, deal
yeah.
with,
So
make it happen for them?
yeah. So currently we have the vaccines, of which we recommend that between 9 to 14 years, that they are supposed to vaccinate and take 2 shots within 6 months. Then 15 years up, we assume that within 9 and 14 years they are not yet sexually active.
Yeah.
But in my part of the country, we even have 10-year-old girls who are sexually active. 11 years they are sexually active. 12 years they are sexually active.
Hmm.
They've engaged in sexual activity, but under normal, if they've not engaged in any sexual activity within 9 to 14 years, they take their
Yeah.
vaccine, they are protected. But if you are sexually active, if you've had sex before, what
Yeah.
we recommend is you have your pap smear done.
Okay.
After your pap smear has been done, even you do what we call a HPV DNA testing.
Okay.
It's done simultaneously with the pap smear. So
Okay.
when you do the HPV DNA testing, the HPV DNA testing will detect whether you are being exposed to the HPV infection or not.
Okay.
Okay. So
Okay.
if it comes out negative for the HPV DNA testing, comes out negative for the pap smear, then you can go ahead to take in your vaccine. And I learned that the vaccine is even up to 45 years, 45 years old. But if
Oh,
you are
really?
sexual, yes. But
Yeah.
if you are sexually active, it doesn't give the 100% protection that we are talking about. It gives you
Okay.
some protection, but it's not 100% protected like the
Okay.
ones who are not sexually active, who have never engaged in any sexual activity before. So we have
Yeah.
something that we call it Gardasil 9. We have
Yeah.
the Gardasil, and we even have the raw Gardasil, which protects you from about more strains of the HPV.
Okay.
We have the Cervarix, which protects you from HPV type 16 and 18, which causes the cervical cancer. So it depends on the type of vaccine that you also need and the money involved.
Okay. That's my other question. How much
Yes, the
does
money
it
involved.
cost
Yes.
to do the vaccine?
So with the vaccine, like with the Cervarix, for instance, one shot in Ghana is almost 500 Ghana cedis.
So what is that in dollars?
So in dollars, I think that will be like, let's say about close to $40.
40.
Yes.
So let me ask you this, please.
Yeah.
We're talking of Africa. We're talking of the rural areas
Yes.
where that is a 2 month salary.
Yeah.
So
Yeah.
how do we expect these people to afford the
To,
vaccine then?
that's the challenge. That's the challenge. I, I,
Yeah.
I could just imagine, when COVID-19 came, African leaders were able to solicit for support elsewhere.
Yeah.
Yes. But we know that cervical cancer is a public health problem, which is killing
Yes.
a lot of women.
Yes.
So, what are we doing about it?
Why
Do
can't
you
we?
expect, why can't we also solicit for support for some of these vaccines from NGOs? We have NGOs who are ready to support for. I read an article which I was really impressed for from Nigeria, that most of the young girls, about 7.7 million young girls were vaccinated
Yeah.
of the HPV, which is a
No,
large number.
Nigeria now is a whole. I will actually connect you with this Dr. Umar, who is the president of the Nigerian Cancer Society. So probably, you know what, he might have information where they can help how they get there, how they were able to get it. They will let you know. And Ghana is a different country altogether.
Yeah, yeah,
So I'm sure he's very, very connect. I mean, he's the president, so I'm sure he has all that information. But make sure, like, you ask our programmer to share his information with you, because
sure.
he is doing an incredible job and
Yeah,
in with that campaign. And they have also partnered with some governors' wives that are doing helping out to get it done. So if you get like a governor's wife, or the first lady, or even the wives of those high-ranking government officials to be part of your drive, your initiative, it helps move the needle. But
yeah,
I just when you told me $40, I just got discouraged. Like,
yeah, yeah.
literally, it's important. Like, how
Wow,
is it
yeah,
even gonna be possible? You know,
possible.
it is. So the only thing is to find organizations that can help, and then maybe do like more awareness with the Ministry of Health, where if maybe they have that. But this is something that is preventable. If it is
100%
preventable,
preventable.
it
Yeah,
is cheaper to do this than to wait for this 1,000 and something women getting sick
yeah,
every year, with the kind of, and if the amount of money
money.
that they pay to get that treatment, and they are not even able to. Probably maybe
Yeah,
70% of them don't even make it,
yeah,
because it is just too late, or don't
yeah,
even have the money for the medicine.
yeah. Pap smear is also expensive. Pap
Yeah,
smear is also expensive. So just imagine, pap smear is expensive. Vaccination is also expensive. At times, you even organize free screenings, and someone will tell you, "I don't have money for transportation to come to the venue."
true. Oh,
So at times some people will tell you that I don't even have money to buy food. You are telling me to go and screen my.
$40. That is when you told me. I was thinking you're gonna tell me like 50 cents American. And I'm like, okay, maybe if we do a ride, a drive, people can be able to raise money to the party. It's sad. It
It's
is
sad.
very sad.
It's
And then
uh,
what? How do people get the virus? How do you get the virus? Can you
yeah.
educate?
You come into contact with the virus through sexual intercourse.
I
You know,
see. I
yeah,
see.
through sexual intercourse. And um, what happens is, one good thing about this virus is when you have a stronger immune system, or when you
Yeah.
have a stronger immunity, and you are
Yeah.
being exposed with within the space of some few months, your body is able to clear the virus on its own.
Oh,
But
thank God.
just imagine you have a weaker immune system. Usually,
Then
I tell people that, yes, I tell people that HPV infection or the virus is a merciful virus, because this virus can take up to 30 years before it can finish its job. So you can be
really,
exposed, yes, you can be exposed with HPV at the age of 30 years, and you begin to experience symptoms at the age of 50 years.
so it's a
It takes
silent killer.
It's a silent killer.
Yeah.
So if you
Yeah.
don't screen, you'll not get to know. And
Wow.
one common way that has triggered the spread of this HPV infection, like as I said, through sex, multiple sexual partners. And in our part of society, now we are seeing multiple sexual partners at something which is normal in our society.
Yeah.
So you have a lady having 2 or 3 more partners at the same time, moving from one man to another. You might never know. Men, we are the carriers.
Yeah.
At
Oh,
times,
so
yes,
yeah, yeah. Okay,
yes.
okay,
So a
okay.
man might be carrying the HPV infection, but you don't know. You move from one person to another, your chances of coming into contact with the virus is very high.
Very high.
Some
Very high.
ladies, it's not your fault. A lady might be having one partner, but that partner is having multiple sexual partners.
Yeah, yeah,
So
yeah.
that's not a fault of yours. You
Yeah,
have only
no, but
one
it's it's
partner.
it's it's a two-way street. It could be she's
Yes,
having more boyfriend, but or
yes,
she's having a man that has multiple women, and that other
yes,
multiple women, one of them have a multiple men.
yes.
So
So
you
the
never know,
transmission
you know?
continues. Yes, the
Yes,
transmission
yes. Oh my
just
goodness.
continues like that.
It's
And
just
at times,
scary.
yeah, a lady might be in a relationship. The relationship does not work out. She moves on to another man. The second relationship does not work out. She moves to the third person. It's also
Yeah,
termed as multiple sexual partners. Because the men that you are changing, you might not know whoever is harboring the
yeah.
HPV infection. So all
And there's
these things are
and there's not and there's nothing like can you be tested for this
no,
before?
no, 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 no. That's the issue. That's the issue. Whenever
Yeah,
it comes to like our sex life, we are always in a hurry. So
yeah,
whenever the hormones are activated, you forget about testing. And
yeah.
after the activity, then you come back to whatever you know. And one thing which is killing most of our women now is the douching,
What?
the frequent douching.
Oh,
About
that
90%, yeah, about 90% of every lady wants the vagina to be tight.
oh. So
I
douching can make it tight?
Yeah, we have people who do ginger, all those kind of concoctions,
You
insert
know
it
that is
inside them.
you know that is all non let me not even curse out. You know all these things is like really honestly, you go and be
Yeah,
putting ginger.
yeah, inside your vagina. We even have vagina sprays and deodorants in town. Now, now some ladies want their vagina to smell like strawberry, apple. So we have a strawberry vagina flavor. We have the apple vagina flavors and all those kind of things. Usually
I
I
think
tell
this I
ladies,
think I think this is one dialogue of Khuraira that I will never forget. so, so the
so
competition is so high that they
the
need
competition
different
is so,
flavors.
yes, so they want to spice up the homemade. Usually what before, if you use ginger down, they use it for your food, spice your meat will taste better than insert inside the vagina. There's no vagina tightness anywhere. You just stay true to yourself. I tell ladies that we are in a confused world. We're in a
Yeah.
confused world where a man wants the penis to become bigger, a lady wants the vagina to be tight. As the
Yeah.
man, where are you going to insert it? The woman is craving for the place to become smaller. The man is craving for the thing to become bigger. As a man, where are you going to insert? Because the thing is becoming smaller.
All right,
So
all right, Blaise, that topic we need to move on. Oh my God. So in terms of like getting the screening, so
yeah,
the person get so I just want women to understand at this stage, if this happened to me, this is what I have to deal with. And and for someone like, for example, someone that you said she has multiple partners,
yeah,
not because she is seeing them all at the same time, but maybe because it didn't happen with this one, and then
yeah,
in
yeah,
today's society,
yeah.
do you advise like every month one to do screening, or and again, if you think of it, you said that it takes a long time for it to surface.
Yeah.
So how would one need to need to do to help themselves when you are already that active?
Okay. So with cervical cancer, we have something that we call the latency period. Okay.
Okay.
So it starts from what we call a precancerous stage.
Okay.
So whenever your doctor examines your cervix, there are cells on your cervix. Okay. So
Okay.
whenever your doctor examines or do the pap smear, realize that there's abnormal growth of the cells on your cervix,
Okay.
then what will happen now is it's not a time, it will be at that stage that we call the latency period or the precancerous stage where much can be done for you. Okay,
Okay.
so it has not yet gotten to the cancer stage. So whenever you catch the thing at the precancerous stage, more can
Mm-hmm.
be also more can be done for you. But we
Okay.
usually advocate that at least every 2 to 3 years you need
Okay.
to
Oh,
have
so it's not like
your
every month you
no,
need to be doing it.
no.
Okay.
Every
Oh,
two
okay.
to three years, you have your smears
Okay.
done. But if you are a lady, usually I tell ladies that don't forget your signs and symptoms. You need to know yourself as a lady. You
Yeah.
need to know yourself. So know what is normal in you, so that when the abnormal thing sets in, you get to know. When you
Yes.
have unusual vaginal bleeding, all of a sudden you bleed for a long period of time. Some people can
Then
bleed for
something
like
is
2 weeks.
wrong.
Yeah, 2 weeks, 3 weeks, they are still bleeding. At times,
Yeah.
fibroids can cause that those forms of bleeding. But aside that, you are not supposed to bleed for that long period of time. So if you're
Yeah.
a lady and you are bleeding for that long period of time, you need to report to a physician. If you
Okay.
are a lady and you have sex and you bleed afterwards, postcoital bleeding, you need to report. At times, one funny thing in our
Oh, no, no.
society is that
Can you repeat that again? What did you say?
I said postcoital bleeding, bleeding after
Okay.
sex, bleeding
Okay.
after sex. You
I see.
know, yes, we have one funny thing in our society when you are having an affair with your husband, and at times the penis of the man can hit the cervix. So
Yes.
whenever the cervix become cancerous and that there is that kind of penetration and it hits the cervix starts to bleed,
Yeah.
because at that point in time the cervix becomes fragile. So
Yeah.
anything that hits it, it starts to bleed. So you
Yes.
might have sexual intercourse and bleed afterwards. So
Ah,
when it happens that way, you need to report.
I see.
The
I see.
same way when you experience pain during sex,
Yeah.
consistent pain. Some of the
Ah,
pains might be due to vaginal dryness. Some
yes.
of the pains too might also be due to pelvic
The fragile.
infections, yes, or pelvic inflammations. You will
Yeah.
experience pain. But aside that, you should not be having consistent pain during sex.
Okay.
Okay, because when the cervix becomes fragile, you'll be experiencing those kind of pains, and you need to what report. So aside we say it every 2 3 years, you should
Mm-hmm.
get your screenings done. When you see these abnormalities occurring in you, you need to report to a physician. You have
Yeah.
unusual vaginal discharges. The normal fluid that comes out from the vagina smells like an onion. That's the normal scent of the fluid that comes out. And with
Mm-hmm.
cervical cancer or cervical cancer, it comes in the form of a rotten fish. Very,
Ah,
very offensive.
okay.
Very, very
Okay.
offensive.
Okay.
And
That you
any
yourself, you will feel it that this is not normal.
yes, this
Yeah.
is not
So that's
normal.
what you mean by women know yourself, because you know
Know
how,
yourself.
yeah, you know how,
Yes, yeah, you know
yeah,
how
yeah.
your
So
whole body
if that
looks
is
like.
something that is off how you usually are, then you should make sure that you talk to your doctor or go to even a
Yes,
clinic. And
yes.
and so in what about the women that complain of stomach ache all the time? Do you think that cervical cancer can be part of that too, or no? No,
No,
it's
with
it's
stomach ache, stomach ache, it can be related to cervical cancer. It might be
okay.
due to other conditions. One thing that makes medicine very difficult is that most of the signs and symptoms are very similar. Okay, so when you are experiencing some of these signs and symptoms and you don't report to the hospital, then at times you wait in the house and it will be at the later stage. So any signs or symptoms, you need to report to the hospital because most of the signs and symptoms are very similar. Okay,
Yeah.
but stomach ache might be related to something different, but not necessarily cervical cancer.
And especially you said that it kind of has similarity with fibroids. Is it the
Yes,
fibroid?
yes. They bleed in the way you bleed. Yes. So
Yeah.
someone might be having fibroid and be bleeding for a longer period of time. And
Mm-hmm.
cervical cancer also presents the same signs and symptoms. So it's something that you need to try as much as possible and report. And
Yeah.
one thing, if we don't take it within the next 5 years, cancer cases across Africa will go up drastically.
So that's one my next question. There was a documentary I saw. I don't know if it was on Prime or HB. One of the documentaries that um, skin cancer also is
Yeah.
in a serious rise.
Yeah.
I think there was a ban in Ghana about it, especially on some of the creams.
The
So
creams.
no, it can be related anyway, because this one is about exposing the skin to like different chemicals you're using.
Yes. So when you expose your skin to these chemicals, it
Yeah.
reduces your immunity. It reduces your immunity.
Okay. And then
And what?
cervical cancer, when you
Yes.
have a very good immune system,
Immunity.
fights it.
Yes.
I see.
Yes. Yes.
I see.
You,
So
you
it
you get
kind
it.
of, in a way, end up being correlated, in a way.
Yes.
Yeah.
Yes. In a way.
Because if
Yes.
this one and again, it's the same thing we're trying to get and the thing that I always say, Ghanaian women, they have this beautiful, glistering, dark skin. Like,
Yeah.
like really no one patch that is uneven. Why
Yeah.
in the hell would you want to go and put some cream that will never give you that the whole face the same? It will give you patches because you
Yeah.
will,
Yeah.
you know?
Most ladies are not confident in themselves.
Yeah.
Inferiority complex. Most people don't believe in themselves. Usually, I say that the whites are not racist. We
Yeah.
are our own racists. Yes, we at times we stigmatize ourselves,
Yeah.
and those people that we usually call celebrities,
Mm-hmm.
those people
Oh,
that we put on billboards,
yeah.
those people that we use to market product. At times, a woman might sit down and say, they've used a fair lady on this billboard attached to a particular pomade, attached to a particular cream. Or maybe because the person is fair that she got that kind of contract or what. So
Yes.
let me
And you
start to
think
take,
that she used it and that's why she is that fair.
you
Yeah.
get it.
Yeah.
So you
Yeah.
start to also switch off and be using all sorts of things. And at the end of the day, the desired effect, you never get it. Now people go to extent to bleach the vagina. We have vaginal bleaching where people go to change the dark melanin.
No, seriously. No, you see all these things, the cases come
Yeah,
to you guys.
yeah,
People all,
vaginal bleaching. Yes, yes. They bleach the vagina, the vulva area. They go in for laser therapy. We even have creams that women go to lie down, open their legs to use laser to take off the black melanin so that the vagina will become fair. Yes, it's in the system. That's why I'm saying that within the next few years, we should be ready to accommodate more cancer cases. How can you go? Some people feel that they are fair, the vagina is darker, so it has to be uniform. So they go and lie down, open their legs. They'll use those forms
and
of laser.
this obviously for people that go and do a laser,
Yeah,
they are
laser.
educated people. They're not ignorant
Yes,
people,
people who are sitting in their
And this is an
offices.
educated person going to do such thing.
So what will you educate your fellow? You have nothing to say. You get it. And now even most ladies are even smoking than the men. That's my biggest worry now.
Which is also another form of cancer, serious form
Yeah,
of cancer.
cigarette contains about 69 chemicals that causes cancer. Cigarette contains
Really?
about 69 chemicals that causes cancer. And the tobacco industry is booming. They need
Yeah.
more members into their ministry.
Yeah.
So they
Yeah.
decided that most of the most of the cigarettes comes out with a pungent smell. So they came together and they said, okay, how do we get more members into our ministry? So they decided to add flavors into the smoke. So now most of the youth are smoking through pipes called shisha. I don't know
So
whether
that's
you've come
another thing I was
across.
going to ask you. Shisha and the other one, the thick
Yeah, we have the
cigarette.
vaporizers. Yes, the
So,
vaporizer, the
so are they
chargeable one.
also cancerous?
Yes,
Oh,
shisha is more dangerous than normal cigarette.
really?
They've used strawberry. We have strawberry flavor. We have
Mhm.
apple flavor. We have the mint flavor. And because of the flavors, most ladies take it for a longer period of time. So a lady can take shisha for like an hour or 2 hours. And according to World Health Organization, when you take shisha for 1 hour, you've taken about 100 sticks of cigarettes.
1 hour shisha. How many
One
cigarettes?
hour, 1 hour section of shisha is equal to 100 sticks of cigarettes.
And there are some people that do it every day, at
Every
least
day, every day.
every day.
Yeah,
This is even their pastime.
yeah. So we
Now
have
I
to,
I was just recently in Nigeria, and I see that they have the parlors. I was in Abuja. They have the parlors now where people just sit, is shake, and they not. I thought actually it was a good thing because they're not going to do it. I didn't know it was that dangerous.
yeah, shisha is more
Wow.
dangerous than normal cigarette, and it's
So
killing
what
our
about
youth.
the vape? What about the vape?
The vapes are also dangerous.
Yeah,
The vape,
but not
it
as.
reduces. No, they are also more dangerous. They reduces your immunity. You get it?
Ah,
They reduces your immune system, and you get into contact with any form of cancer, any form of infection, your
yeah.
system cannot fight against it. And almost now, some of the youth they've been now they are smoking super glue.
Super what?
Super glue, yeah.
How do they smell super glue, for God's sake?
For God's sake, yes. In some parts of Ghana, there was a shortage of super glue in Techiman, where the sellers were saying that most people they will come and tell you their slippers are torn, their sandals are torn, then they will buy the super glue. So when they buy the super glue, they'll open it and touch their nose and they'll sniff it into their system. That's what
And
they
that
do
makes
now.
them high, or what
High,
do what?
it makes them high. It makes them high, like you've smoked. That's what they are
What
doing.
I had the one that I heard of that I really wanted to go crazy. Those toilet pits, the African toilet
Yes,
pits.
yes, yes,
I
yeah.
heard that youths are going there to put their nostrils so they can
Yes,
get high from it.
yes, yes, yes. That's what they are doing. And when you do that, you are not mentally healthy.
Of
You
course,
are not
of
you are
course
you
not.
are you are you are you are sick in your head.
So
So
basically, it didn't. You're not starting with it. You started taking maybe drugs, and the drugs turn your head, and then you start to just get more high, more
yeah,
high.
yeah,
You try
yes,
different things.
your system become used to whatever you are taking on daily basis,
Yeah.
and you don't longer go high as you
Okay.
expected. So you need to increase doses. You need to change drugs. You need to explore so many things which will make you higher more. And at the end of the day, they'll fall in for all this kind of thing. So it's something which, in fact, is killing our youth. It's really killing our youth. And our diet, our diet, our diet, our diet. They're
Yes.
ready to eat food. The canned foods. They are all things that are predisposing us to cancers. The,
So
the, the
let me
fried
ask you:
food.
is there a particular country that you notice Ghana import canned food a lot from, or because we don't do most of the African countries barely have manufacturing facilities to make canned things
Yeah,
anyway.
yeah,
So probably 70% of it is being imported.
yeah.
So, do you find out that maybe they just buy where the country doesn't care what is in the cans that is being shipped to, or the buyers themselves? You know how our people are. They will
Yeah.
go and buy something. They will go to somewhere where they will is you're getting sardine. They will say, okay, reduce the tomatoes, replace it with something else. Do you know what I'm saying, right?
Yeah,
And
yeah,
there is
yeah.
no inspection. I mean, what is it? What causes the rise? You said you are right about that. Canned food, even here in America, canned food is not something that is being encouraged. People that you will notice people that eat a lot of canned food, the way they look, versus people that eat a lot of starch, versus people that the majority of their diet is are greens. You will, if you put three people and make them to eat those three different categories, you will notice to see that the one that put more greens in their diet is healthier, the skin is nicer than
Yes,
those at the other two group. And I
yes.
would think that Africa is, we have the land to have all
Yeah.
these people in your backyard, you know?
Yes, yes, we are blessed. Africa, we are blessed, but we don't value our own things. We rather
Yeah,
value things from the whites.
yeah.
You get it, because we have a whole lot of foods over here that we can consume, like the
Hmm.
grains that we are talking about. There are grains over here.
Yeah,
There are green living vegetables over here.
yeah,
You get it.
yeah,
Tomatoes is over here.
yeah.
Tomatoes has lycopene.
Hmm.
Lycopene is a very good antioxidant which fights against cancer cells.
Can you
We have
imagine?
carrot. Yes, we have carrots.
We have
Carrot
carrot, and
has
carrot is good for what?
carrot contains what we call beta carotene. It also
Okay.
fights cancer cells. It has antioxidant properties which fights against cancer cells.
And what about
The
cucumbers? We have a lot of cucumbers.
cucumbers, yes, anyway, a whole lot. All these
Yeah.
things are very, but we don't make good use of them. That's our challenge.
But the thing
That's
is that even if we have them, we overcook them that they are no longer.
very good. And some
Yeah.
too use too much of fertilizer on them.
Okay.
So at the
Okay.
end of the day, they end up spoiling the vegetables with too
It
much
has a lot
fertilizer.
of chemicals in it already.
Yes, yes,
Yeah.
yes. Now it's hard for you to have organic vegetables.
Hmm.
Most of them are inorganic, being
Yeah.
spoiled with a lot of chemicals. So it causes a whole lot of changes in our system, and your system, whenever your system become used to one thing for a longer period of time, and your diet pattern changes,
Yeah.
then your system begin to react. You
It's
get it.
true.
So it's
True.
something that we need to pay much particular attention to, and most especially to red meat. Red meat, instead of consuming a lot of red meat, consume a lot of red vegetables.
Okay.
We
Tomatoes, beets, carrots,
uh, yeah,
those
all
kind
those
of things.
yes, we can
And
make
we
good use
have
of them.
them. We have them.
We
We
have
have the
them,
red
yes.
cabbage too. We have the red
Yeah,
cabbage too, you know. And I really I admire you, and I feel sorry for you. I'm sorry to say that, because you
uh,
know why? I know how it feels to be around people as a health practitioner. And so I went to School of Health. So I finished, like, it's not like you, like, but it's a
mm,
health, like community health person.
yeah,
I worked for 4 months. I couldn't do it, and because
yeah,
they, when you finish, they post you to villages, right?
yeah,
They
yeah,
are
yeah,
so kind, the people. When they come to see you, they bring eggs, they bring all this. They think that you will do magic to heal them. Me, I will have all my money that I get that I get paid, which I barely is anything. I'm buying some medicine for them, because
yeah,
at the end, I said to my aunt, I said, I can't do this. There was this lady, up till today, she had stayed in my mind. She had diabetes, and she had a wound, and that wound would not heal
yeah,
until
yeah,
she passed.
yeah,
And I got so attached to her that I will even go to her house to clean the wound, because she's this old lady, very nice family. But what
mm,
I wasn't even exposed to what you are exposed to. So
yeah,
why I'm saying is, like, I really. admire what you do, but at the same time, I just feel for you because I'm
Yeah.
sure there are nights you go to bed. The kind of heart you have is that you wish you can just get another dream where they will give you a combination of billion.
Yes, 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 yes,
But you
yes.
know what,
Yeah.
Mr. Blaise, it will come. Everything that you
Amen.
see God had taken you to do, um, it is a journey for
Thank
something
you.
better. That's
Thank
for me,
you.
that's how I look at life. You
Yeah.
know, your story today, you have no clue how many people that will watch this video, not just today, this is going to be on YouTube, it will be there till me and you are gone.
One.
You
Yes,
understand what I'm
yes.
saying? But
Yeah.
somebody will be searching through and see this story, and it's just so it's not just even what you're doing
Yeah.
immediately; it's what the outreach you are doing,
Yeah.
uh, the talks you are doing, the spending the money you don't even have.
Yeah.
God will not leave you alone. He will
Yeah.
definitely make things better for you. And like
Amen.
I said, please connect with Dr. Alassane, and I'm sure he will have some contacts for you, even within Ghana, since he's
Yeah.
a top guy over there. You know, top
Yeah.
guys hang out with top guys,
Yeah.
so
Yeah.
he will know a top guy in Ghana
Yeah.
as well.
Yeah. Yeah.
So I honestly I thank you for coming in and sharing this story and telling us a lot. We spoke a lot on cervical cancer. I would love when it's during Cancer Awareness Month if you would want to be our guest to talk about
Yeah.
it, or any
Yeah.
other time that you feel that you want to use this platform to spread what you know a medium to tell people,
Yeah.
please, if we have space, be our guest, because the
Yeah.
more we educate people and they are able to learn and make us and we are able to save one life, then
Yeah.
what we're doing has mattered. So I
Yeah.
thank you very, very much, and
Thank
God
you
bless
too.
you, and
Amen. Amen.
continue doing well in all your endeavors. And again, thank you for um, coming to Dialogue with Horara. And
Thank
sure,
you. Thank you.
it's 11 o'clock in Ghana right now.
It's 9:35 in Ghana
Oh,
right
okay.
now.
4 hours behind, 1 hour behind
Yes.
Nigeria.
Yes.
Okay.
Yes.
Oh, nice,
Yes.
nice.
Yes.
Wow, wonderful.
9:35. Yes.
Well,
It's,
our time is up.
yeah.
So I want
So,
to say thank you. Thank you,
yeah.
everybody, for watching. And I look forward to seeing you again with another guest. And please, there will be information about Mr. Blaise on our all our handles. If you want to reach out to him, if you are an NGO or if you are any other person that just want to learn more about what he just talked about, please, it will be on our social media pages to reach out to him. So thank you, and follow him on
Thank you.
his handles as well, because I'm
Yeah.
sure he will be posting a lot of informative
So,
things
so,
that you
so,
you in the future.
thank you.
So thank
Thank you.
you, and good night,
Thank
everyone.
you. Good
Okay, bye.
night. Good night. Good
Bye.
night. Bye. Bye.